All right, I want to talk to you about something that doesn't come up enough in the RTM conversation, and that's, what happens if your patient asks, "Is this going to cost me anything?" Right? Because here's what I see happen in practices all the time, and that they add RTM and they struggle with it. And it's not the compliance, it's not the billing, and it's not the clinical side. I mean, sometimes it is, but the front desk or the patient care coordinators will get caught, flat-footed by that question. They don't know how to explain it, and that patient hears and senses the hesitation, right? They hear, "I'm not sure," and they hear, we'll figure it out, right? And suddenly, a patient who would have gladly enrolled in RTM, they opt out because not because they didn't want to do it, but because they get nervous because you're nervous, right? They get nervous because they can sense that there's not, that confidence in the question of cost. And you can apply this to your practice in general, but we're talking specifically about RTM, and I think this is where a lot of practices struggle, right? In most PT practices, the front desk team is not the billing experts, right? They're not insurance specialists. They're warm, they're caring people, who are great with patients, and they have 1,000 things to manage every day. I get that, right? And asking them to confidently handle like the detailed RTM cost question on the fly with a new program without training and without scripts, I think is important. It is really setting them up to fail, and when they fail, patients just don't feel comfortable with it. And so the enrollment doesn't ever grow or it drops. And then your revenue goes down and then you end up thinking RTM doesn't work, right? And when really like the system itself is just didn't support your team. And so this is something really common, and it's a common reason why these RTM programs underperform. You go out and you buy the software from your EMR company or from some big private equity company, and they don't help you understand this stuff, right? But this is very fixable. It's a very easy thing to fix, but you probably didn't even know it existed, right? You don't even know what to tell your people because the company you're working with, or maybe you haven't even added it yet, they haven't really talked about this with you. So that's where I'm coming in. So I built this thing called the RTM Cost Transparency Toolkit, and it specifically solves this problem, right? It starts with like the numbers that actually matter, right? So on most insurance plans, RTM costs the patient nothing, right? There's zero copay because it doesn't represent a visit, right? That's important, right? There's no copay, it doesn't represent a visit. But knowing that and being able to say it confidently to a patient who's staring at you across the front desk, those are two different things, right? They're two different things, right? So this toolkit gives, your staff like word for word scripts, for the 8 most common cost uh, conversations that I've seen happen. It's not bullet points, but they're more like talking points. And there are actual scripts, and we've given them to our staff, but it really helps them understand what to say. And by the way, your providers too, probably not just your front desk, but it helps them what to say when a patient asks, "What will this cost me?" What to say when they push back, what to say when their deductible applies and they're concerned. It even includes like insurance verification checklists that we have that we've implemented in our practice, and it's a step-by-step thing. So your team really can confirm the coverage before they're enrolling somebody, not after, right? And so I think that's an important piece here. And it also has a denial management process, right? Because sometimes claims do get denied for RTM, and you really need a system for handling that cleanly so it doesn't become like a patient complaint. They get an EOB and they think it's their responsibility. And I've also included a one-page quick reference card for the front desk, like a printout. They can laminate it. They put it right next to the phone. We have one. And so really what we're trying to do here is we're trying to help all the people out there that are working with or trying to add or currently trying to optimize RTM in their practice. We're doing really well with it, and we want to make sure that you do as well. So we're trying to give you as many tools as possible. When we implemented this system in our own practice, our patient cost complaints dropped, below 1%, right? Less than 1% of people will complain about this. And that means 99 out of 100 patients enrolled in RTM with no complaints, no confusion, no billing drama. That doesn't happen because patients don't have questions, but it happens because your staff, your team is prepared and understands the unique behaviors of these RTM codes. And they can answer those questions clearly and confidently before they become like issues months later when the patient gets an EOB. Now they're calling your billing team or your billing company and they're complaining, right? we've seen all that. And so we've really established a program and a system that helps us prevent, those concerns, right? By just being transparent. And so you can get this guide right below this video. All you have to do is click the link. It's free. And appreciate you listening to this video. Hopefully you enjoyed it as much as I enjoyed making it, and I'll see you next time.